And welcome to Ataxia, Assistive Technology, and Swallowing. As a general disclaimer, the information that we're giving here today, anything that you take from it should be used in consultation with your providers, specific to your case or that of your loved one. And anything that we mentioned today, specific products that we show or demonstrate, are not necessarily being endorsed by myself, Todd, or by the NAF. So Todd and I are both faculty members at the University of Central Florida's School of Communication Sciences and Disorders. I'm also the regional coordinator for the FAST Atlantic Region Demonstration Center here in Orlando, and we have no financial relationships to disclose relative to this presentation. So starting off, I'd like to start with the quote, "For people without disabilities, technology makes things easier, but for people with disabilities, technology makes things possible." And I think that's a good frame of mind to have anytime you're thinking about technology, that it's the item that you add or incorporate into your life that just helps make whatever it is that you were already hoping to do possible. Slide. So today I'm going to go through a few different AT systems or devices across some different categories, and then very briefly talk with you about some service providers and how you might locate them if you're interested in more information. In general, when we talk about assistive technology, it really runs a gambit. There's equipment that will assist people with deficits in the areas of vision, speech, or communication, either in listening comprehension or more spoken speech and expression. A range of products to assist with hearing needs. Computer, either hardware or software that can be added or modified to an existing system. Mobility aids to help with moving around in your environments or seating and positioning for health and safety. We also talk about vehicle modifications and environmental adaptations at home or in the community that'll help make it easier to get around and be more independent. We also look at daily living aids, things to be used in kitchens, bedrooms, and bathrooms as we go throughout our day to make things a little bit easier, as well as those recreational aids that help us to continue doing the things that we love. Slide. Now, assistive technology for ataxia, there's a huge range of items that could apply to any given situation. There's a great amount of variability in the presentation of individuals with ataxia. So whenever we look at tools or systems that might be of benefit, we need to look at things like the severity of the condition or the symptoms, the age of onset, whether pediatric or something acquired later on, the overall general presentation, what areas or systems within the body are being impacted, and any comorbidities, because for many people, it's not ataxia in a vacuum. There's other factors to consider when making any kind of recommendation. We try to look at all of those things as well as the environment and the general use and needs of those individuals to try and come up with the technology that's going to help make you as independent as possible. Slide. So I put in a few examples across those different categories. In terms of mobility and positioning, we look at things like wheelchairs, standards, walkers, canes, any of those items that might help with mobility, moving around in your environment, making sure that it's done safely and with as much independence as possible. We also look alternative positioning, and those could be seat adaptations that are used to assist somebody to be able to work, participate in recreational activities for things like eating, bathing, all of those activities you do on a regular basis and allow you to be more safe and independent. Slide. In talking about architectural adaptations, as people acquire different symptoms or as they may progress, some of these needs may change. And there, we look at things like adding ramps as needed, possibly elevators, accessibility in a restroom and things like toileting or showering. We look at the transportation needs that someone might have, as well as workplace or school assessments, depending on age. We want to make sure a person's able to be in an environment that's adapted to allow them to operate as much as they would like. Slide. As we've seen an increase in smart home technology over the years and home automation in general, we've come up with a lot of applications for use with individuals particularly those who might be experiencing challenges in either their gross motor systems, so their ability to get up and move around in their environments, or their fine motor systems, so being able to manipulate items throughout the day. And so with some Bluetooth technology that's available right off the shelf, it allows people to adjust things like a thermostat, an alarm, doorbell, and many of those systems can also be added to things like a phone, an iPad, a tablet, or AAC system or computer to really create a global solution to many different challenges. Slide. When we look at computer access, and this is really across the lifespan, we have to take into account both the physical access to the system as well as some of the software and programming. Physical access could mean adapted keyboards, adapted mice or joysticks. There are systems to help with eye gaze or pointing as well for those who don't have good functional use of their hands. And next slide, we're going to talk about some software adaptations. Mine's frozen again. Is it just me?
So far, it looks like it might just be on your end. Please wait just one moment.
There it goes. Okay, I apologize. There's also a range of adapted software, and these can be put on standard computers as well as in use with that adapted hardware. Some of these systems will go speech to text, meaning I don't have to use a keyboard. I can speak into a microphone and the typing will appear for me. I can go text to speech. If I'm not positioned well, I can have what's on the screen read to me, as well as things like magnifiers and adaptive equipment that allow me to reach some of those items or interact with the product itself more readily. Slide. There's a range of equipment when we talk about daily living. On the left, there's a couple of items for feeding. The one on top is a robotic arm that helps with feeding. And the one underneath it is a computerized spoon that actually assists with anyone who may be experiencing something like tremor. And the top part of it will actually move and accommodate those tremulous movements. The reacher on the right is great for people who maybe have challenges standing or moving around in their environments and allows for reaching those items kind of kept out of sight. Slide. For our pediatric set, we want to make sure everybody's able to play, and we don't want to forget that is the learning of children. So we are switch adapted toys. We keep a range of those in many facilities as well as loan libraries so that children can even check them out and trade them out and allow them to play, learn, and grow like any other child. Slide. We have a few examples here of adapted items used for cooking or work around the home. Depending on different fine motor abilities, so difficulties with strength or endurance, things to help you grip or lift. Many different types of aids can be trialed to find one that'll best meet needs. There's a huge range of equipment when we talk about augmentative and alternative communication. And really, AAC refers to any type of system that augments typical communication. So that could include gestures, blinking, expressions, computerized systems like you see here, sign language, whatever it is that helps meet the need of that individual. Slide. These are some examples of some low-tech systems. So in general, systems that don't require power, they're going to be more static. They're also much less costly and often are a great solution either as a backup for somebody who maybe does have a high-tech system, or those that don't have them, they're a great alternative when funding maybe isn't an option as well. Slide. There's a range of speech generating devices. These are going to give you that voice output to allow you to be heard in a situation where perhaps somebody is turned around, it's a noisy environment. They're also going to allow you to generate novel messages. So the images you see here allow you to type different messages on the display. And typically they're going to accommodate a range of access methods. The device in the top right has an eye gaze module along the bottom, so it allows someone to make selections using their eyes and doesn't require any use of fine motor extremities. Next slide. So when we talk about acquiring assistive technology, if you are in a position where you want a full-blown assessment, we're going to be looking at our healthcare providers. For communication, some of those augmentative communication systems we saw, as well as some cognitive supports, some computer language software items, things like that, a speech language pathologist is going to be a great resource to you. Your physical therapist should be able to help you with any of those positioning, seating, or mobility needs that you might have, as well as report writing and assistance with funding through insurance. Fine. And for those activities of daily living and other elements of computer access related to fine motor issues or some seating and positioning needs, an occupational therapist is going to be a great resource. If you don't have a rehab professional that you're already working with who's familiar with assistive technology, the Rehabilitation Engineering Society of North America, or RESNA, is a great resource. And on their website, you'll be able to search for providers who have that assistive technology professional credential, and it runs the list of SLPs, PTs, or OTs. Every state in the United States and territory also has a State Tech Act program. These are all federally funded and do not require any fee for service. They'll do things like provide a demonstration. So if you're trying to decide between some of those eating utensils, if you have one but you need more training and support in its use, or you want to try something out before buying it, they do loans as well. And if you step one forward for me, there is a website called AT3, and you can search every state in the country and find your local resource that is there for you.
Okay, thank you so much, Carolyn. We all appreciate learning about assistive technology. I want to take a few minutes, the rest of our time together, to speak with you about difficulty swallowing and individuals with ataxia. I think most, if not some of you here today can understand that difficulties moving muscles, either in your legs, your extremities, your arms, those types of movements are impacted by ataxia. But sometimes we don't think about how ataxia might change the way the muscles that we use during swallowing might be impacted. So I'd like to share some information and potentially some resources for you should you be in need of any assistance with actual eating and drinking. So when we look at statistics, it's kind of interesting to note that each year 1 in 25 people in the United States experience difficulty swallowing. It's not something that we think about often until it happens to us or someone that we know or love. It does occur more often in adults who have neurological disorders such as ataxia. It can impact quality of life, obviously, if it's difficult to eat, difficult to swallow, to drink. It lowers the quality of life that you experience, and it becomes more challenging and therefore more effort and less enjoyable. Difficulty swallowing may impact nutrition and hydration because it's more challenging to get the nutrition that you need and stay hydrated through drinking fluids. And even some individuals who have difficulty swallowing can have problems with their lung health, where they end up with lung infections. And so that's also very important to kind of consider as we think about personal well-being and safety. And it is good to note that while difficulty swallowing is seen in individuals who have ataxia, it typically remains a mild to moderate disorder rather than being the more severe types of swallowing disorders that we see in other populations. Now, difficulty swallowing to healthcare professionals, and I want to teach you this so that if you hear this term, we'll all be on the same page and can help you as best as possible. Dysphagia is defined as difficulty swallowing. It is pronounced dysphagia, and really all that means is not much more than there's a problem with your swallow. So I want to kind of list in this slide some things that you may be on the lookout for, either in yourself or your loved one, as some potential symptoms of dysphagia or difficulty swallowing. People who have a diagnosis of dysphagia sometimes will drool. They'll have food or liquid remaining in their mouth after they swallow. So some remaining food maybe in their cheeks. An inability to keep their lips closed while they're eating or drinking, which then can lead to problems with keeping food in your mouth. It might fall forward out of the front of your mouth. Food or liquids can leak into the nasal cavity, up into your nose. And that, I can tell you, I think for many of us, whether we have dysphagia or difficulty swallowing, that can be very painful. Sometimes people complain of food sticking in their throat, or they experience pain whenever they swallow. Sometimes we see that more with solid foods, that are tougher rather than with liquids. A wet or gurgly sounding voice after eating or drinking can be an indicator that foods or liquids are trying to or are going down the wrong pipe. That's something we want to look out for also. And if we have something go down the wrong pipe, we typically will cough. So any coughing during or right after eating or drinking may be an indicator of a problem with someone's swallow. And because if we swallow down the wrong pipe, we will end up with something in our lungs that we shouldn't have, such as food or liquid. It can cause difficulty coordinating breathing and swallowing, and potentially even a pneumonia or respiratory infection. And along with those often comes fever. People who have difficulty swallowing often need extra effort or time to chew and swallow. So if we notice that someone, instead of is taking 20 minutes maybe for the average meal, it's now taking 30 or 40 or 50 minutes or longer, that might be an indicator that there's a difficulty with actually being able to swallow well. And then obviously, whatever it is that we drink and or eat helps us stay healthy. So people with difficulty swallowing are at higher risk for weight loss or dehydration. But I want all of you to know that if you see any of these symptoms and you're concerned that you might have some difficulty or your loved one might have some difficulty with swallowing, that help is available. Typically, the first line or the first person that you would want to mention your concerns about swallowing to would be your primary care provider, either your physician, your nurse practitioner, or physician's assistant. And they often work in collaboration with other healthcare professionals, and so they can potentially get you directed towards the professional that would be able to help you the most if you do have difficulty swallowing. As most of us here today know, ataxia is often, or if always, a neurological disorder. And so a neurologist would also be a good referral source, a good first person to speak to. Often ear, nose, and throat doctors or specialists, they specialize in the throat and its function, and they are able to offer assistance to individuals who have difficulty swallowing. And then what Carolyn and I both do, but different aspects of the profession, is we're both speech language pathologists. And it seems odd that someone who would be responsible for patients or individuals' safe swallowing would rest on somebody whose title is speech language pathologist. But because speech and language pathologists are trained in all of the muscles and anatomy of the upper parts of our throat and down to where our voice box is, we are typically the leader of the teams in individuals who have difficulty swallowing. And then obviously, as we mentioned in the last slide, if there's weight loss or dehydration that's being caused by difficulty swallowing, dietitians are really important individuals to have in your life because they can assist in making sure that you maintain or your loved one maintains enough nutrition and hydration and potentially is able to do so the most efficiently. And then, of course, as it was kind of mentioned in the last section on AT services, other therapists can help with physical activities, such as physical therapy and occupational therapists. They often collaborate very closely with speech pathologists to provide services. If you find after going to a healthcare provider and expressing your concern about your swallow or your loved one's swallow, there can be tests that are performed to actually see how safely and how efficiently the individual swallows. So a primary care or specialty provider may send you to a speech language pathologist. And it's important that they do so with someone who is a specialist in treating dysphagia or difficulty swallowing. The tests that can be completed for swallowing include the patient or the individual eating and drinking foods while the clinician, which is in most often cases the speech language pathologist, while they observe. And this can be done in a clinic, during an outpatient visit, or sometimes there are swallowing tests that include actually taking x-rays of the swallow while an individual swallows different foods and liquids. And also there are tests where an endoscope or a flexible small tube with a light and camera is inserted through a person's nose to actually look at the swallow while somebody swallows food. The results of these swallowing tests are really, truly important because what they do is they offer specifics into what might be going wrong with a person's swallowing. Because there are different types of dysphagia, different things that can go awry during a swallow, it's important that your healthcare provider and clinicians actually identify specifically what is wrong with the swallow so that we can best treat it and manage it with our patients. And speaking of treatments, speech language pathologists work together very closely with doctors and nurses, and to be honest, as I mentioned earlier, other healthcare professionals to customize a treatment plan. Because just as whenever you think about assistive devices and technology, not every individual with ataxia needs every piece of equipment. The same is for swallowing. So there are individualized treatment plans that the healthcare professionals will devise to treat the individual as a person whose swallow may be different than someone else's. Treatments can include things such as changing the way you sit or hold your neck while eating and drinking, adaptive tools to utilize while you're having your meals so that it becomes easier to eat and uses less effort, making it more enjoyable. There are even exercise programs that you can do with your mouth and throat and tongue that may strengthen and or help coordination for swallowing better and safer. And then, of course, your ENTs or your primary care providers may recommend some types of medications dependent on what exact type of swallowing disorder is identified. Here's a tip I would definitely like to share with all of you. Because speech language pathologists treat so many different disorders, from children learning to speak or having challenges speaking and communicating, to adults who've had strokes and or other neurological disorders such as speaking and having ataxia, and also swallowing, it's important that anybody who has concerns about their swallowing advocates for their own best care. And one tip I'd like to share with you, as I mentioned, is that if you are looking for a speech language pathologist to help you, and you have ataxia, and you think you may have some difficulty swallowing, I highly recommend that you seek out a speech language pathologist who states that they specialize in treating people with movement disorders. So there are a lot of, in major metropolitan areas across the United States, movement disorders clinics that have physical therapists, physicians, occupational therapists, and often speech language pathologists. That would be an example of a really good place to reach out to. And I've included on the slides here some of the references from the research and literature that I've used. I do want to mention the first listing on this reference is the American Speech Language Hearing Association, more lovingly referred to as ASHA, ASHA, by those of us in the profession. They have a website which is full of the most amazing information for both the communities and individuals who have difficulties with communication and swallowing, and also for the professionals who provide care for those individuals. So I'm hoping that you found today's talk beneficial. I'm hoping none of you have to reach out to a speech language pathologist for our services, but if you do, I want you to feel confident and empowered with maybe some extra information so that you're able to seek out and achieve the results that you're looking for. Thank you so much. And I know Carolyn's here with me, and she thanks you also. And we look forward in the live chat to actually answering any questions that you may have.
Welcome. Thanks for joining the session, Carolyn and Todd. Great information. We get a lot of questions about this topic at NAF, so it's going to be a great resource to have moving forward. So I wanted to thank you guys for your time. To our attendees, I know there was an issue with the video playing. It got the screen got frozen on one screen, but the audio continued. So sorry about that. If you want to see the slides that were presented, they are available in the platform. If you go to the schedule and go to the session, it should be a link on that page, so you can download those and view those later. So apologies for that technical difficulty. And then we do have about 17 or so minutes to answer some questions. So if you want to pop those into the Q&A section down at the bottom of your screen. We do already have some that came in, so I will jump right in if you guys are ready. All right. Can you talk some more about the spoon that you can use for tremors?
Absolutely. There's a couple of different styles of spoon that individuals like. Some of that preference is based on the severity of tremor, just personal preference. If there's any comorbidities or things that might require, larger grip, things like that. One style that I included in there was the liftware spoon. That is the computerized version. So it actually has computerized pieces in the handle that will adjust the movement based on your tremor. So if you're shifting your hand to the left, the computerized piece will kind of help move the attachment to the right to counterbalance some of that movement. There are also weighted utensils that can be of great value to some people. Just that additional weight is enough to offset and keep some of the spilling from happening. The utensils are definitely one of those items I strongly recommend people reaching out to, like one of your state's AT center. Often they'll have a range of them and you can try them out prior to purchasing. That liftware set is great, but the base unit is about $200, and then you have to spend for each attachment. And for some individuals, the weighted spoons are enough, and those sets are much more cost effective. So definitely something to test out and see which works best for you and your need.
Well, Stephanie, you're muted. Sorry.
Sorry, Anne asked, can hiccups while eating be related to swallowing?
That's a really good question. Yes, the reality is that in a vast majority of cases, hiccups are not all that concerning whenever we think about general health. There is a number of people who will swallow air as they swallow, and that's not normal, whatever normal is, and that can lead to hiccups. What I would say as a professional who works with individuals who have difficulty swallowing is that if you notice hiccups occurring quite consistently after eating and drinking, speak with your physician to see whether or not he or she would agree that you should, or that you would benefit from a swallowing evaluation. I wouldn't worry too much about it though.
Great, thank you. Next question is, what happens if the available testing comes back negative or is too painful to fully complete?
Well, that's another great question. I will say, as somebody who does all kinds of swallowing testing, that the typical range of pain that patients refer to during a swallowing assessment is minimal to none. The average swallow test should not be even uncomfortable. As I mentioned during the presentation, there is one swallowing test where there's a small tiny tube that with a camera on it that can be put in a person's nose and then directed to the back and look at the swallowing. But the x-ray test and the clinical test in an office setting is not painful. It's as painful as eating. So that's a really good thing. It's typically well tolerated, all of the tests for swallowing. Now, if you believe that you have difficulty swallowing and you have one of these tests as recommended by your healthcare provider and the results come back negative, unfortunately, it is much like many other tests in that the tests are not 100% accurate in all instances. So it is possible that an individual could have a negative result from a test and yet still have some sort of difficulty swallowing that healthcare professionals are unable to identify. But what I would say to any individual or to my family member, if that happened, is I would say, continue to advocate for yourself. If you believe that there is a problem and somebody's telling you that there is no problem, there's a certain amount of us knowing our own bodies that kind of outranks maybe somebody who says, oh no, there's nothing wrong with you. That was my advice.
Great. Will a chest x-ray show if you have ever aspirated?
No, it will not. A chest x-ray can show and very often does show the presence of pneumonia. When, excuse me, when that pneumonia happens because a person aspirated, but you and I and everybody in this room aspirates a little bit all the time. And so, no, that will not show up on an x-ray. Only whenever whatever it is we swallow down the wrong pipe actually turns into an infection and shows up as a pneumonia. Then we can see that on an x-ray.
Awesome, thank you.
Mm-hmm.
Why does ataxia cause dysphagia? Is it general control over swallowing muscles, epiglottis control, both, other?
It's general. In any disorder or disease where muscle movement is impacted, where there's a change in the way our muscles and our body moves, we may expect that the muscles that we use, which by the way, can you believe that in here, there are 50 muscles that have to work not only well, but in concert with each other in order for us to take a drink of water. It's amazing to think how many small, tiny muscles there are. But so if an ataxia or any other neurological or movement-based disorder can impact the movements of our hands, it also has the ability, not always, but has the ability to impact the muscles that we use to swallow. So it's not uncommon that we see difficulty swallowing in individuals who have ataxia.
Right. Do we generate the same level of saliva when we sleep? If swallowing is difficult or slow, is there any guidance for swallowing during sleep or just lots of drool?
Well, and there are several approaches to the management of saliva. None of them are perfect. I will be honest with you. What I might recommend is we do swallow less whenever we're asleep, but believe it or not, our bodies still do occasionally swallow without us knowing it when we're asleep. I would try lying on the side with a towel underneath me so that the drool or the saliva comes out of the mouth rather than back into the throat. We don't want that if we don't need it. And then also, if drooling or production of saliva is really a quality of life issue for you, please speak with your primary care physician or your healthcare provider. There are some medications, most of them being in the antihistamine kind of family of medications, that can reduce the production of saliva, and that might be a solution to help you.
Thank you. Does dysphagia get worse with advancing symptoms?
Typically, yes. Just like I said before about how any movement disorder can impact the muscles of swallowing, as the impact of muscle movement increases with other parts of the body, we might also expect it to progress in swallowing. The reality is, though, that as much as we know about ataxia, the brain, and neurological disorders, there's a whole bunch more that we don't know. So science is always continuing to try and answer these questions, but we do realize and accept that there's variability in swallowing across all individuals.
Great, thank you. Carolyn, it looks like we got one for you now. Are there iPhone compatible programs that you recommend for voice banking?
Yes and no. There are some programs that are out there that will work with an iPhone, such as the Voice Keeper. First, it's probably important to make sure to distinguish between there's voice banking and then there's message banking. And they are two different methods of preserving your manner of speaking that for some people both can be used, and some people only really qualify for one or the other. Voice banking is giving a series of samples of your voice through a structured system that they then use a computerized digital system to create a unique computer synthesized voice using your pitch. So what that does is, if you need a dynamic AAC system later on where you're generating novel messages, you can still use your voice. Whereas message banking is a system of recording exact messages in your voice. Some people, like I said, are able to do both if they start early. Some individuals, if their speech is deteriorated to an extent, message banking may not be viable. So the original question about iPhone compatible, there are some apps that can be used. Voice Keeper is one of them. There's a few of them. The main issue that we run across with individuals who may have some, for example, tremulous head movements or variation in pitch, is if you have inconsistency in how your voice is being picked up, it could degrade the quality of the recording. So best practice often for these types of recording is to really get a nice headset that wraps around, do some practicing, get consistent spacing between you and that mic in a quiet space to really ensure best quality. Some of these companies will even take small samples first and give feedback if they think it's possible. And while our iPhone cameras, or excuse me, microphones have improved quite a bit, the quality is different from some of the other ones. And just to keep repeating myself, many tech centers will have some of those recommended recorders. Zoom Recorder is the name of one that's often recommended. And many have those to loan, as well as many organizations. So something I would strongly recommend considering so that you're using your energy and recordings in the best and most efficient way possible.
Thank you. Let's see, should I use head flexion position when swallowing to prevent aspiration, or what position is best?
I personally love that question, because head flexion, some of you, or I know lots of other people, have heard the term chin tuck fixes a swallow. The reality is that because there's 50 muscles that are used to swallow, and that they have to work in a certain order and in concert with each other, it may be that a chin tuck makes a person swallow less safe, or what we might say worse. So it would be irresponsible for me as a speech language pathologist to say, yes, a chin tuck works to make the swallow better, if I hadn't actually done an x-ray swallow or some other type of assessment where I can see specifically what type of swallowing problem you're having. So while I wish it was an easy answer and I could say, yes, it works, the reality is that I can only say for some people it does, and we need to test to see whether or not it does before we would recommend it.
Got it. All right, we got another person that asked, my swallowing issues are not consistent, only occasionally, like sometimes when swallowing pills. Would a swallow center test be able to pinpoint the problem if I'm not experiencing the problem at that moment in time?
Fantastic question. Thank you, Brandon. It is possible. What I can say is that a little bit of it is like, oh, my car sometimes makes a weird sound, and you take your car to the mechanic. And of course, when you're at the mechanic, the car does not make that sound. And the mechanic goes, well, I can't fix what's not there. What I will say for speech pathology is when there's an x-ray swallow done, or with the camera and the little tube that goes in the nose, if there's a smaller area for a pill to go through, that still can be recognized. And even though in that moment you might be able to swallow a pill, it is possible that we could get enough information so that we could make some recommendations on what might work to help you with that problem. Thanks for that question.
Great, thank you. Does excessive sneezing during or after eating a meal relate to any swallowing disorder?
I believe that if you were to ask all speech language pathologists in the United States, you would have some that might say yes. The truth is, we do have research, hard data from research, scientific research that shows that there's no correlation between a runny nose and or sneezing and a problem with swallowing. So if you're sneezing, that's good news that we don't think there's anything wrong with your swallow.
Carolyn, here's another one for you. Are there specific adaptive technologies that you would recommend for Canadians?
I will admit that's the first time I've had that question. Not necessarily. Assistive technology is always going to be dependent on a person's need and presentation. And while there are some vendors that are outside of Canada, I know Daisy, which is one of the most popular mounting companies, they're out of, I think, British Columbia. There's a few agencies. Most products in the US will ship. I think the bigger question, and I apologize, I've only ever worked in the United States, is going to be related to funding probably. And the healthcare system obviously is very different in Canada than it is here. So I can't speak to those options as well, but I would typically encourage people to investigate the sources and what's available to them before going off and having to privately purchase items. Again, because I know the shipping costs, if they are coming from the US, can add up very quickly. So by investigating some of those options, you might find that you have more available to you than you realize.
Great, thank you. We got someone in the chat asked, does everyone with ataxia have swallowing problems?
Good news, no. It's just more common in those who have ataxia than it would be in what we would call the general population.
Gotcha. Sneezing is a hot topic. Why do I sneeze after I cough?
I'm not sure. I would not be able to explain that within the scope of my practice. I apologize. Maybe that's something you could speak with your primary care physician.
Gotcha. Are there iPad apps that can assist with generating speech or communication?
There are a lot of them. There are, depending on what you need, there are some that are text to speech, meaning mostly QWERTY keyboards, some keyboards that can be adjusted for size and orientation. So if you have a hand that is more usable than others, if you require larger buttons for accuracy, some have axis settings so that if you have a tremulous movement, for example, it can have a delay or allow for a hold to kind of eke out some of those. Key guards can also be helpful. They're kind of a plastic piece that fits over whatever the app is. And then there's separate sets where you can do kind of longer recorded messages organized by category and those types of items. It really depends on the user. And I do work with people who use more than one. So some individuals may prefer certain apps for certain types of communication. For online ones, the ones that really speed up their novel typing messages, but they like to have other apps available so they can pre-record, for example, an order at a loud and noisy restaurant where they've previewed the menu, they know what they want to ask for, they'll kind of record those in advance. But there's a huge number of them these days. Many of them do also support free trials for a period of time. So again, trying them out whenever possible to really make sure that they work for you is always recommended.
Great, thank you. And then we are at the top of the hour and all out of time for questions. Sorry, guys, I know there was a lot more. Like I said, it's a very hot topic. We'll have to maybe invite you guys back for a webinar later in the year to readdress some of this stuff. But if you guys have any closing thoughts or pieces of advice.
I will say this, and just by scanning really quickly through the questions that I see coming in, I have family members who have disorders which are not fun on a daily, to live through in a daily setting. And I know that we all want quick fixes and simple answers that will work for everybody. But unfortunately, if you feel as if you're having difficulty swallowing, there is no better advice that I can say than for you to see a specialist, such as a speech language pathologist, because anybody that recommends that you do something without formally assessing you, I'm just concerned that that is not going to be what's best for you. So I can't make blanket statements, but thank you so much for having us here. We really appreciate it, and I wish you all the best.
And same for me. I would say there's such a huge range of assistive tech, and a lot of times people are going to tell you what works for them or what matches with their diagnosis. And of course, everybody's different. So yeah. I did put the link for AT3 in the chat. That's our National Assistive Technology Act program here in the United States. You can find your location in your state. And of course, depending on what type of tech you're looking for, a clinician such as a speech language pathologist, occupational or physical therapist can give you a more robust assessment and help you with any paperwork for funding. So please, thank you very much for having us, and feel free to reach out via email for any questions or follow-up if we can be helpful in any way.
Great. Thank you guys for your time, guys. This was a great session.
Thank you so much.
The video will be available for you guys to view. We'll also have it on our YouTube channel after the platform's not available. And then we got about a 15-minute break, and then the closing ceremony and dance party will start. So head on over and let's have some fun.
Yay. Bye-bye, everybody.
Bye, guys.